They're some of the city's most vulnerable hospital patients.
Only a small percentage of babies actually need to come here after birth.
Young babies already facing uphill battles in life.
Unfortunately, a second baby and one team member in the special care nursery at the Centenary Hospital for Women and Children have tested positive for COVID-19 overnight.
That brings the hospital cluster to 5, including 2 visitors. None are in a critical condition, but it's a frightening wake-up call. It's not known how COVID got into the nursery or how it's spreading among the babies in its care. In all, there were 41 new cases reported in the ACT today. 15 COVID patients are in hospital, a record 7 of those in intensive care, 6 on ventilators. But with COVID moving around inside Canberra hospitals, there are lingering concerns that nursing staff are being poorly protected by ill-fitting masks.
So this is for the masks that go on the face, and it's about the rubber seal around the edges. Every face is slightly different.
Fit testing masks is a critical step in infection control.
Ask the health worker to perform a fit check and provide guidance as required.
But only a fraction of hospital staff have gone through the 45-minute procedure.
We have over 6,000 staff in our health system. How many of them have been tested and how many of them should have been tested?
Around 2,500 team members at the Canberra Hospital have been fit tested. And more than 500 at Calvary Public Hospital in Bruce. The priority for fit testing is on our healthcare workers who are working in declared red zones.
That's staff in emergency, ICU and dedicated COVID wards. But that's far too slow, according to the Nursing Federation, which sounded the first warnings back in July last year.
We might consider that if they haven't been fit tested, that we would consider that they are not wearing a mask at all.
And now calls for those staff to be brought back from the front line.
So if they are able to move nursing staff that haven't been fit tested into areas where there is less risk, that would be the right approach.
And for the rest of us, masks indoors are here to stay, at least for now.
It is a relatively cheap and effective, but also not too burdensome, hopefully, measure to continue to do for a little while.
But the broader ACT community has crossed another vaccination milestone. 96% of Canberrans have now had their first dose.
I'm incredibly proud that we're on track to be one of the most vaccinated cities in the world.
And fast closing in on the next important mark, 70% double-dosed. Craig Allen, ABC News, Canberra.